Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
We have reported on this programme often enough on the way NHS budgets are under intense pressure now. And of course, everyone knows the NHS cannot necessarily pay for every new treatment for every illness. But still, an exclusive survey of GPs and hospital doctors conducted by News at 10 has revealed that a number of pretty basic services are starting to be rationed.
Treatments like hip replacements and the removal of cataracts, hearing aids and mental health services. They're not cutting edge, just the stuff we need to get by. Yet some patients aren't getting them, told to go private if they can, or wait till their condition gets worse.
How much?
£3.
So I've got an hearing aid that's broken. I can't quite hear. £3.
Yep, £3 please.
For 20 years, Robert G from Staffordshire got his hearing aids free on the NHS.
Thank you.
But new financial restrictions mean he's no longer eligible for replacements, although one side is broken and the other nearing the end of its life.
Where do I go to and how much is it going to cost? The top of the range is £3,000. Your hearing aid could break tomorrow. You've got to find £3,000 for a hearing aid.
His case, one of many recorded by 1,000 doctors ITV News surveyed. 69% admitted they were already rationing some services. 90% said they believed further rationing in the health service was inevitable, yet over 3/4 concluded that the NHS was right to ration care. This London GP tells me he's successfully appealed against refusals to fund minor operations for his patients. But it's often a postcode lottery.
If I can demonstrate that it is for his livelihood and will affect his ability to work, and therefore he won't claim benefits, he will be able to function, I can get the job done.
You can do that here in Camden, but not in other parts of the country?
In other areas, one hears that these are absolutely unobtainable because of funding issues.
And this is why we are a growing ageing nation, putting relentless pressure on England's hospitals. Earlier this week, their chief warned of a stark choice: more money or draconian reductions in care. Even the Health Secretary's former lieutenants agree.
£10 billion sounds like a lot of money, but when £30 billion has independently been assessed as being the requirement that the NHS has in the next 5 years, then we need to make sure that money is found, the government finds that money and it goes into frontline patient care.
After this week's weather, it might feel like winter's still a long way off. But with mounting evidence, patients are already suffering. The question now is not what we'll have to give, but whether it already has. Rachel Younger, News at 10.
We are constantly hearing about how the current NHS model is unsustainable. So, out of interest, how do other countries pay for their basic healthcare? Well, the French pay up front and are then at least partly reimbursed by the government. A GP visit costs £20, 14 of which is paid back. Most people buy top-up insurance to cover the difference. The Germans are required to have health insurance, but most insurers there are non-profit organisations charging less than 8% of monthly salary, which is matched by employers. GP visits used to require a £9 consultation fee, but this was scrapped in 2013. In Sweden, healthcare isn't free, but the costs are modest and they're capped every year. A GP visit is £18 or thereabouts, and Swedes pay a maximum of £100 in a year on all of their care. In Australia, most people pay £30 to £40 to see a GP, about half of which is reimbursed. Hospital care is free to all. So this is a good moment to bring in Rachel to try and assess really what's happening with this. There's not much policy behind this as far as we can determine.
Not much at all, and the reason for that, I think, and the reason we hear so little about this, is that these are decisions being taken at a local level, and different areas in the country are cutting different treatments and services, so it doesn't make the national headlines. Why is that? Well, essentially, right at the centre, the Department of Health insists that the funding settlement the NHS has for the next 4 years is sufficient, and that hospitals and surgeries should be able to balance their books. So it's local decision makers who are taking these calls. Look, we've known for a while that rationing exists. Think about IVF, for example. There's an enormous regional variation in how many cycles you may or may not get. But I think what we've uncovered here is wider evidence that very routine treatments, very routine services, your access to them does depend increasingly on where you live.
We talk often on this programme about the pressure on the NHS, pressure on budgets. Is the basic truth that we're just going to see more and more of this over the next 4 or 5 years?
Well, I think that is going to depend on the bravery of our politicians. Jeremy Hunt has made it clear many times that he feels this government gave the NHS what it asked for in order to get through until 2020. Now, if it can stumble on till then, and it is a big if, I think even the Health Secretary himself is starting to acknowledge that by then there will need to be the kind of injection of cash we saw Tony Blair putting into the NHS back in 2003, something very substantial. The question is whether he and whether our new Prime Minister are brave enough to start what could be a rather unpalatable debate about how that's funded.
OK, Rachel, for now, thank you very much indeed.
I've been getting away with it all my